Welcome back. Well, more than 34 million Americans are living with diabetes, and among those, many of those have died from COVID-19. About 40% of those people that have passed away due to COVID were living with diabetes. In November, well, it's American Diabetes Month. It's a time to take action, to raise some awareness, control, and hopefully even prevent this disease. So today, Sue Cavalier's joining us, manager of the Sanford Diabetes Center and Diabetes Education Specialist, here to talk about diabetes and reducing our risk. So, Sue, great to have you here. Let's just, for many people, we hear diabetes a lot, but just explain to us what it is. And I think there's different kinds. And so thank you for doing that.
Yes, thank you for having me. So there are different kinds of diabetes, and our bodies normally make and use a hormone called insulin that helps to keep our blood sugar levels in range. And when someone has diabetes, the body either doesn't make insulin or enough insulin or use it effectively, which can then cause our blood sugars to rise too high. And of course, that's concerning for us because high blood sugars can impact our health in many different ways. And the two most common forms of diabetes that we see are type 1 diabetes, where the body stops producing insulin. And this type of diabetes can occur at any age, but people will require insulin for management. With type 2 diabetes, this is actually the much more common form of diabetes. The body often does still produce insulin, it just doesn't use it effectively or properly.
So has anybody figured out yet sort of the tie between people with diabetes and how it just seems to be exacerbated, or how COVID is impacting it, or it just seems like there's such a unique and interesting tie to those two things?
Well, there really isn't necessarily enough data to know whether or not people with diabetes are more likely to get COVID-19. The challenge becomes is that people who have diabetes do face a higher chance of experiencing serious complications of COVID-19. And that's why I do think it's very, very important that people manage their diabetes effectively and follow those recommended guidelines of wearing masks, washing hands, staying socially distanced, so that we can limit those risks of exposure to that virus.
And as far as symptoms of diabetes, what are some things people should be looking for?
Yeah, so the challenge is that oftentimes, particularly with type 2 diabetes, people have no symptoms at all. The symptoms of diabetes occur when those blood sugars become excessively elevated. So oftentimes we see people coming in because they have increased thirst and urination. They might be experiencing extreme fatigue. They might have cuts or sores that are not healing well. And it is very important that people, if they are experiencing these symptoms for an extended period of time, it's imperative that they do see their healthcare provider for evaluation and help with managing that.
And correct me if I'm wrong here, but type 1 isn't necessarily curable, but type 2, I do have a chance at least to mitigate it or almost eradicate it, right?
Well, you can. I mean, the management tools are very important, but we know that type 2 diabetes is very manageable. We know that there are many, many people out there who have what we call pre-diabetes, and this is a precursor to diabetes. So we can prevent diabetes occurring in a number of ways. And the things that we can do as far as that goes is reducing weight, following a healthy diet, increasing activity. Even just moderate weight loss can make a very big difference as far as reducing those risks of developing diabetes.
And what can everybody be doing this month, since it is Diabetes Awareness Month? What kind of things can we be doing to help raise awareness and make a difference?
Well, I think knowing those risk factors is really important. So, individuals do have a higher risk, particularly for type 2 diabetes, if you are age 45 or older. If you have immediate family members who have diabetes, if you're overweight or physically inactive, if you have high blood pressure or high cholesterol. For women, if you've had a previous history of gestational diabetes or diabetes during pregnancy, or women who have been diagnosed with polycystic ovarian syndrome. Those risks of diabetes are higher. And people can actually take a free and very easy assessment online at diabetes.org to kind of learn about where those risk levels at, and also to know ways or learn about ways that you can reduce those risks of developing diabetes.
Sue, I got about 30 seconds left. I'll give you the last word. If people want more information like that, what should they do?
Well, again, there are lots of resources out there. I highly recommend that people talk to their doctor about those concerns and risk factors, be honest and open about concerns. The American Diabetes Association is an excellent resource for information. The Diabetes Center here at Sanford has resources available. For those individuals who do live with diabetes, it is important that education and knowledge is key, and working with your provider and your team. So your medical doctor, your dietitian, your diabetes educator to help you manage your diabetes effectively.
Sue, thank you very much. We appreciate it.
Thank you for your time.
Yeah, thank you. All right, stay with us. We got a lot more coming up right after this.